Okay, so I'm here. Greetings, family. I trust we're all striving for wellness, for better wellness, and sharing wellness with each other with openness that we afford the family members that we truly love, and hold close to ourselves, that we can extend it out, to everybody worldwide. I must confess, though, it is an honor to have been asked to participate, and therefore, I know already I have permission from an upstanding community elder to speak on the subject of sickle cell anemia on this platform today. So basically, on behalf of myself and my team, I take this opportunity to say thank you, dear sister Angela Rose, co-founder of AGA Global Ambassadors, for inviting our organization to share this platform with other brothers and sisters who are also sharing lessons for better health, because we sit here recognizing the honor it is to have been chosen and to have been included in such a phenomenal event. So anyway, my name is Samantha Greaves. For those that don't know me, I am a community volunteer. I am the founder and group coordinator of this organization, and known in the community affectionately as your sickle cell warrior queen. Right, so the reason for that is because in the UK, sickle cell patients, people that have the sickle cell, condition, are known as warriors. And obviously, because I created a foundation or organization, they call me the Queen. So that's where we get Warrior Queen from. Right, so Sickle Cell Cause was founded in 2015 with hands-on assistance from our former chairman, Curtis Augustus Stewart, who sadly passed in 2017. And also our current chairperson, Basu Leanne Palmer, and even though we've been officially operational, since 2015, personally, I have been an active member of the community for sickle cell support since 1997. So I do have a vast knowledge of community work with regards to supporting my sickle cell peers. Right, so not only have I come before you today as a sickle cell warrior, somebody that lives with the sickle cell condition, but also as an active advocate, of true understanding and empathy, what life is like living with the sickle cell condition. So to begin with, we have 3 weeks left for the AGA Global Ambassadors World Health Month for 2020. So we've got 3 weeks left. And I take this moment to recognize the continued works of Angela Graham Associates, known as AGA, and also the great works of the old Jeshua Health Center in the Gambia. May all persons involved with all the works of these important ventures continue to rise together to ensure the works continue, no matter what challenges, we must face and overcome, because we overcome them. Now, Sickle Cell Cause, or the Sickle Cell Care Advocacy Unity Support with Empathy Group, last visited our home, the Gambia, in 2018. We first visited the Gambia in 2015 with AGA. We went on a trip with AGA Associates, and that was my first experience of setting foot on the motherland. And except for last year, due to Thomas Cook or Thomas Crook, that fiasco, and then this year, due to pandemic, we've returned to the Gambia every year since 2015, and in 2017 we was there twice, and that was basically to help assist the works of education, prevention of sickle cell crisis, and holistic treatments within the Gambian sickle cell community. We began this by visiting orphanages, schools, the Edward Francis Hospital, and we sensitized in the more rural areas, of the Gambia. And we also spoke on Taranga Radio, which was great fun, and overall we've been truly encouraged to do something positive with the knowledge that we have gathered, as we've done our work throughout the Gambia. Right? Along the way, we have met many Gambians who continue to support our organisation and our works, and we've also met many Gambian sickle cell warriors, and their families, and we support them, and we will continue to support them, and we just look for your support to help us to support the sickle cell warriors that are living in the Gambia in these days, right? So we've decided that with the aid of fellow volunteers from Sickle Cell Cause, we will use the next 3 weeks, as best possible to share our knowledge of sickle cell awareness and the sickle cell condition with you, beginning today with the subjects of what is sickle cell and how do the sickle cell cause actually work in the Gambia. So I will begin now by sharing my screen and take you through a PowerPoint of what is sickle cell. Thank you. Okay, so I've got my screen up, and to begin with, we'll basically talk a little bit about our vision, right? The vision of the Care, Advocacy, Unity Support with Empathy Group, otherwise known as the Sickle Cell Cause or SC Cause. Now, as I said earlier, we began operations officially in 2015. I felt a great need that there was a need for a support system for sickle cell warriors, and their carers and families, right? And I have a great empathy for my brothers and sisters in Africa. So we automatically wanted to include the African continent with the works that we do. Before then we was traveling to Spain every year, sometimes twice and 3 times a year, doing our health programs, our natural health programs, but we felt that it was best to be doing this in Africa, and we chose the Gambia through AGA. Now I didn't create the organization myself, although it came out of my head. I was supported greatly by my best friend Curtis Augustus Stewart, who sadly passed in 2017. It was his dream to see a center built on Gambian soil, with sickle cell cause, on the front door. We're striving for that vision to continue to take place. And also, my daughter, who is a trained qualified social worker, she gave up her job, and started to volunteer with Sickle Cell Cause, and she is now the current chairperson, and she is also the family welfare officer, right? So the vision, to support the Gambian family, the vision was to support the Gambian family to recognize and combat the symptoms of sickle cell anemia until a cure is found and accessible to everyone worldwide. Right, so we are Sickle Cell Cause, and this is us in the Gambia. This is me in the Gambia with some sickle cell patients outside Edward Francis Hospital. Right, so what is sickle cell? I've been saying sickle cell a lot, but many people may not know what exactly is sickle cell. Well, sickle cell is an anemia, right? Now, there are many types of anemias out there. It's a condition whereas there is a deficiency of red cells or hemoglobin in the blood. And there are over 400 recorded types of anemias out there. The most common known are like iron deficiency anemia, leukemia, thalassemia, hypoglycemia, general anemia, and the fastest growing worldwide, even though it's not recognized as such, is sickle cell anemia. Now, sickle cell anemia is a serious inherited blood disorder. There are over 100 recorded types of sickle cell anemias out there, with 6 in number being amongst the most common. These are the most common types of sickle cell anemias out there: hemoglobin SS disease, hemoglobin SC disease, and you can see there's others. Moving on. Now, the issue is that the red blood cells which carry oxygen around the body develop abnormally, and this causes an extreme deprivation of iron fluorine, which can cause over 20 other diseases and conditions to manifest. So when somebody says that they have sickle cell anemia, believe that they don't just have an issue with their blood running through their veins, they have other issues as well, right? The sickle cell anemias mainly affects people of African, Caribbean, Middle Eastern, Eastern Mediterranean, and Asian origin, right? And these are the areas of the world that you will see where it's more prevalent, you know. And these are some where sickle cell SS disease and sickle cell SC disease is more commonly found in people of African heritage in these areas here. Now, to have the full-blown sickle cell anemia, you will have inherited the defective gene from both parents. If you only inherit the gene from one parent, you have what is known as the sickle cell trait, which means that you likely to have some sickle cells in your blood, you know, but you are able to produce normal blood cells as well, and you won't usually experience as severe pains as somebody with the full-blown condition. However, you will be a carrier of sickle cell anemia, and therefore you may pass the abnormal gene on to your children, you know. So it is important, and I stress that children at birth should be tested to find out whether they carry the gene, if they have sickle cell anemia. And even in adulthood, you may be carrying the gene without knowing, you know. Not everybody that has sickle cell trait feels pain, you know. You may feel a bit tired and maybe putting it down to something else. Get tested. And that is what our works in the Gambia is all about, you know. So when both parents are trait carriers, there is a 1 in 4 chance in each and every pregnancy that the child they have will have full-blown sickle cell anemia. So that doesn't mean that if you have 4 children, only one will have it. What it means is that there is a 1 in 4 chance in every pregnancy that you will have a child with sickle cell anemia, which is a good thing because that means there's a chance in 3 out of 4 that you won't, you know. So we can look at it as a positive as well. Right, now here's some statistics, some UK statistics. Right, so official UK statistics state that there are 250,000 people are thought to have the sickle cell trait in the UK, United Kingdom. The official number of sickle cell warriors is 15,000, although when we know it is believed by health officials that the number is a lot higher than that and around 30,000. And this is considerably growing consistently. Right, so normal red blood cells are flexible and disc-shaped like a donut, like this round shape here, you know, so that is a normal blood cell, right? But in the case of sickle cell anemia, they have a lack of oxygen, so they are abnormally shaped like this crescent moon shape here, right? Or this farm tool, which is called a sickle, and hence that's where it gets the name from, sickle cell. So that's the reason why sickle cell is called sickle cell, because the cells are shaped like that farm tool or a crescent moon. Now, the lifespan of a normal blood cell or normal red blood cell is on average 120 days. However, the abnormal blood sickled cells, you know, have a shorter lifespan, a considerably shorter lifespan, and aren't replaced as quickly as the normal blood cells. So on average, the lifespan of a sickle cell is only 20 days, which is 100 days difference, you know. So this will cause symptoms, you know, and results, daily symptoms, you know, that will manifest into other issues. So here are some average symptoms of the sickle cell warrior, you know. Now, sickle cells, as I said before, are devoid of oxygen and are unable to move around as easily as normal shaped blood cells, you know, so they will block the blood vessels, as you can see in this diagram here, you know, which results with tissue and organ damage, daily pain, lethargy, which is complete extreme tiredness, and episodes of extreme pain known as a sickle cell crisis. So you may see your children have swellings in their joints, their fingers, their hands. These are signs of sickle cell in childhood. Headaches in these areas of the head are very common, and you have to look out for things like aneurysms grow in the head, you know, because the cells push out the veins, you know, stretch out the veins and can cause aneurysms. Chest infections and pneumonia are prevalent in sickle cell as well, and the cold. Even when the sun is shining, you may feel an extreme cold and have a lot of fever. All right. So daily symptoms are severe joint pains, headaches, complete lack of energy, an unquenchable thirst, tiredness, breathlessness, considerably cold, and anxiety attacks. Right. And a sickle cell crisis can last from a few minutes to several months, although on average, the average sickle cell warrior will have a sickle cell crisis from around 5 to 14 days. Now, the average sickle cell patient lives with full body pain on a daily, right? Regular bouts of life-threatening sickle cell crisis, eating disorders, drug dependency on prescription drugs, trauma anxiety, memory failure, tooth and hair loss, ulcers that can be in the stomach, on the legs, so that's inner and outer body ulcers, swollen joints, migraine, hearing and vision impairment and loss, extreme depression, and has a morbid fear of impending death. Right? Now, the results of this is that the symptoms manifest into ailments such as iron overload, jaundice, migraines, as I mentioned earlier, gallstones, chest infections, breathing difficulties, strokes, especially in childhood. Children many sometimes have many strokes, extreme strokes, and it's not noticed, and then they have like a brain damage and things like that. So these are some signs to look at for which we will speak about in further weeks. I'm just going to quickly go through like symptoms and ailments, for today. Right, then there's the swollen and the removal of the spleen. You may notice your child have a swollen stomach, all the time, and very tender to the touch. Reduced bone density, leg and stomach ulcers, as I said before, blindness, priapism, which is when the penis becomes swollen and lumpy, and it won't go down, and this can cause impotency. Also there's pneumonia, organ failure, a weakened immune system, and then there's slow or even sudden death. And some of these ailments are contributed by the prescription treatment. So our aim is to help our sickle cell warriors to reduce the amount of prescribed medications and go a more holistic, healthy route to managing your sickle cell. Right. Now, in the UK, most patients are relying on the National Health Service for their treatment and are dependent on the conventional treatment of daily antibiotics, and this is to prevent infection. Then there is pain relievers daily. These are known as controlled drugs or CDs, and this can be anything from like Oromorph, which is morphine, tramadol, pethidine, so these are very strong pain medications, and they do have like a street value. When I say that, if it gets into the wrong hands, people will sell them on the street as social drugs. So there is a stigma attached to the sickle cell warrior with the medications that we have to take, being, that we are black, and then, having these extreme pain, needing so much strong medications, it causes a stigma of disbelief, because on the surface, we may look very well, Then there's vaccinations to prevent infections, and this depends on the actual warrior. This can be administered monthly, annually, or whenever required. Everybody's sickle cell is unique to themselves. Then folic acid daily, and this is to help produce and strengthen red blood cells. So the folic acid is very important. And then some people are relying on blood transfusions. Some people like myself have stopped taking blood transfusions, and try to refrain from them by staying as well as possible, But many sickle cell warriors, it's a blood condition, so are dependent on and relying on blood transfusions. Now, a crisis can be triggered completely unexpectedly, and there is no known cure for sickle cell anemia. However, it is also triggered by cold, damp conditions or extreme change in temperatures from hot to cold to hot. Stress can cause a sickle cell crisis, and dehydration. So we do encourage that you drink water continuously through the day, preferably without sugar. Infection and bruising also can cause a sickle cell crisis. Now, the treatments, as I said, there's no known cure, but then there is things like bone marrow transplant, also known as stem cell transplant. Right? Now, this offers the only potential cure for sickle cell anemia. Right? This treatment is reserved for extreme cases of children under the age of 16 years of age. Over this age, there is a heightened risk of death on the operating table, and that's a 75% risk of death. So it's only reserved for children under the age of 16 in very extreme cases. Finding a donor is difficult for this procedure, and the procedure is painful and has serious risks associated with it. So even under the age of 16, there are high risks to it, and this includes death. This procedure is not available on the NHS. And then there's hydroxyurea. It's a medicine in tablet form. When taken daily, hydroxyurea reduces the frequency of painful sickle cell crisis and might reduce the need for blood transfusions and hospitalizations. Hydroxyurea works by stimulating the production of fetal hemoglobin, which is a type of blood found in newborn babies that helps prevent the formation of sickle cells. However, hydroxyurea increases your risk of infections. It strips you bare, like if you're taking like if you have cancer and you go through chemotherapy, it has that type of effect. And there are some concerns that with long-term use of this drug, it may cause problems in later life, for people that take it for many years, So we at Sickle Cell Cause, do very strongly promote holistic health, daily holistic health, self-care, and looking into ways of managing your pain so you are not so reliant on these strong medications and having to rely on the hospital. So yoga, the practice of yoga and chakras in sickle cell cause is very important to us, as it exercises the joints, helps you to stretch, which helps to oil the joints. Also it allows relaxation and meditation to bring down, give you a calming effect, so the stress is not so heightened. Also things like reflexology, and other, therapies, we encourage strongly within sickle cell cause. Also reading, just taking your mind away, reading something that you find stimulating, golf is very good as well, always walking around, swinging your arms. We even do things like jewelry, beading and jewelry making to help, nimble the fingers, things like that. So also we are very strong on your nutritional intake. We strongly advise that you refrain from taking meat and dairy products, and try to have as much raw, fresh food as possible, relying on fruit, vegetables, seeds, and nuts as much as you possibly can. White foods we try to ask you to abstain from, because they cause starch in the blood, which causes a sugar, and this can cause like your blood cells to stick. So when I say white foods, I'm talking of like white rice, try to go for brown rice. White sugar, try to go for brown sugar. But we do strongly promote that you don't take any sugar at all. So these are the type of foods, and then we'll be speaking more about that in later weeks. Now at this stage, I'm going to ask Basu Lian, who is our chairman, to come on and speak to you about what does Sickle Cell Cause do in the Gambia, on the ground in the Gambia. Thank you for having me.
Greetings, family. Greetings. What an honor it is to be here, sharing knowledge with you all. Greetings and welcome to our AGA Global Ambassador family, our Gambian family, our sickle cell warriors. We're all family here. So thank you, Sam, for taking us through what is sickle cell. It's so important for us to have a deeper knowledge and understanding of what actually the condition is and the effects that it has on people individually and families as a whole. So I'm Leanne Palmer. I am the chairperson of Sickle Cell Cause, and we're honoured to be working in partnership with AGA on this amazing health awareness month. It's a shame that we can't be in Gambia right now, but it's amazing that we're able to do something as huge as this. So I'm just looking forward to hearing all the different tips and, you know, nuggets of wealth and health that are going to be coming throughout the rest of the month. So we are here to talk about sickle cell cause. We've heard about what is sickle cell cause. And so I'm just going to share with you a bit of our journey that we've had with our warriors in the Gambia and the understanding that we've come to regarding how sickle cell affects people on the motherland. So just for some brief statistics, over 80% of people with sickle cell anemia are born in Africa. According to the World Health Organization, sickle cell is particularly prevalent in areas where there's high malaria transmission. So in Africa, where there's over 200,000 infants born with sickle cell every year. Annually, the mortality rate of those is 1.4 to every 100,000, which is very high. On average, mortality age is 5. And that is so sad, considering that we're in the 21st century. You know, we think we're advancing with technology. You would think that we have a hold on conditions such as this. So just to kind of touch on the malaria side of stuff, because that's quite an interesting point and is sometimes often misconstrued. So the sickle cell gene presents a survival advantage against malaria, which to some extent explains the prevalence of the disease where malaria is endemic. So with regards to people with carrying the sickle cell trait, they are less prone to being infected by malaria. Yes, and we've already gone through how sickle cell works and how it attacks the red blood cell. But the thing is, for those that actually have the full-blown condition, they are more vulnerable to catching malaria because their immune system is weakened. So that's a very important point to kind of understand, because a lot of people be like, oh yeah, if you've got sickle cell, you know, you can't get malaria. Yes, you can get malaria. It's the people with the traits that are carrying the trait. So there's more people carrying than there are people with the actual condition. So that is why it is so important for people to be tested and to know whether you're carrying the trait or not, so that you can make those life-changing decisions consciously, as in when you're going to marry someone and decide to have children, you want to know what your sickle cell status is beforehand. So I know it's been said already, so we have visited Gambia consecutively, and with the aim of engaging and meeting with people that are living with the condition, so that we can get a better grasp on what are the needs. So we've always gone to set out to identify the needs of the sickle cell warriors in the Gambia, to explore the struggles of our warriors in the Gambia in comparison to the struggles that we have here in the UK, and to consider some of the solutions, the what, where, when, who, how our offer of support ought to be delivered. So with that being said, and with that being the drive of our engagement with the warriors on the motherland, we've been able to come to some understanding. So firstly, we've come to an understanding of how generally the health service is delivered in the Gambia. And there's still much research for us on our part to kind of delve more into that. But we understand the healthcare system is built around 3 levels, being the primary, the secondary, and the tertiary. So we have an understanding of the primary services being focused on villages populated with up to or more than 400 people, where they would have a village health worker and traditional midwife. So we have been to some villages where that is the case, but we're not entirely sure if that is really happening across the board, because we've had contradicting feedback with regards to that. So it would be interesting to delve more into that area. We understand that with the secondary kind of tier, you have 8 main health centres and a further 16 smaller health centres providing inpatient and outpatient treatment, with resident nurses, doctors, and ancillary staff. And then you've got the tertiary, which is more about what the government is providing. So the Gambian government operates 4 referral hospitals, as well as a medical research council, which is actually funded by the UK. And then in addition to that, you've got privately run clinics, as well as health-focused NGOs. So it sounds like a lot going on there. But when we start to unpick, we've come to find that there are quite prevalent struggles for the sickle cell community, despite there being quite a vast range of healthcare services within the country. So when we did visit, and when we have visited the Gambia, one of the places that we spent quite a bit of time was with the Edward Francis Teaching Hospital. And that facilitates the needs of children with sickle cell up to the age of 15. The hospital has a crisis unit for emergencies and a sickle cell clinic running every Wednesday and Friday, which I must say was packed. But the times that we visited were overwhelmingly packed, with children in severe pain seeking assistance. Generally, following a child's diagnosis, a series of weekly appointments are scheduled for monitoring and followed up by monthly routine checks via the clinic. So what we saw at the clinic on our visits is children coming in for their routine checks, and then a larger portion coming in on emergency cases, emergency situations. So we were warmly welcomed by sickle cell consultants, Dr. Abdul Gai and Dr. Lamin KC, who kindly gave us a tour of the hospital grounds and facilitated our engagement with several families affected by sickle cell anemia. And you can see from the pictures there some of the families we were talking to, and we had some really engaging conversations where we was able to get a more in-depth understanding of their lived experience and reality, with regards to the care of their children and the services that they receive. So just to give you a few brief case studies, this is just really, really brief. So we spoke to several children and their parents. There's a 10-year-old girl here, she was diagnosed with sickle cell at the age of 8. She suffers severe pain, shoulder and hip pain, and has great difficulty walking. A 3-year-old we met, diagnosed at 8 months. She was suffering with crisis and suffers monthly. Mum says that it's a monthly occurrence that this child is in severe pain, in crisis, not just severe daily pain, but actually in a full-blown crisis where she's needing hospital and medical attention, and the impact that has on the rest of the family and the child's schooling. Another child here, 8 years of age, suffers with pain, particularly in the joints. She's missing a lot of school again, and mum doesn't know what sickle cell is. That statement came up several times. Mums not actually knowing what sickle cell is. They know that it's painful. They know that their child is sick, and they know that their child needs help. But for them to actually say, what is sickle cell? They were not able to say that. They were not able to explain what the sickle cell condition is. And that's for us what we found really concerning, So there's other case studies there. 11-year-old girl, she was diagnosed at 3 months. She described her daily pain on a scale of 1 to 10 being 8 and often 10. Mum is concerned with the amount of time she has to take off school. She understands very little about sickle cell and struggles with the cost of medicine. And again, the cost of medicine was something that came up in every single case that we looked at, the cost of medication. And there's a few other, there were a few other case studies there as well, all kind of emphasizing the same issues. So as well as visiting the hospital and visiting families in their homes, we did visit a few schools and orphanages, and we spoke to teachers. We did some awareness with teachers, explaining to teachers what is sickle cell and, you know, what they should be aware of and how they can assist supporting a child with the sickle cell condition. And they were really grateful for that knowledge and information, because even some of the teachers don't know what sickle cell is and don't know how to manage that when they're faced with a child in crisis. So that was a really big piece of our work during our visits in the Gambia, and also helped to form our conclusions on the work that we need to do to assist. So the identified challenges facing our sickle cell warrior community in the Gambia. One of the main things was the knowledge and awareness. The lack of knowledge of what sickle cell is, its hereditary nature and lifelong implications was very poor, particularly for parents. And in addition to that, there was a lack of knowledge around nutrition and how nutrition can actually help to ease and prevent serious crisis. Another thing that we kind of picked up on was language barriers. So there's several languages spoken in the Gambia, and we found that doctors and medical staff, the patients were not always able to speak the language that the doctors and medical staff spoke. So there was some words are lost in translation, and some patients actually need translators that are not always available. So language was a barrier in terms of getting the clear, concise messages across from medical staff to patient. Hospital resources was another one. So particular machinery that's used to determine an individual's type of sickle cell condition, i.e. whether they're SS or SC, was limited. So where some patients are coming to the referral hospital and then being referred on to another hospital to get scans and to get other treatment, it's very difficult when you're dealing with a patient and you don't actually know what type of sickle cell that they have. So already there's so much room for error in those type of situations, and we picked up on that. And then kind of just touching on the fact that they're being referred to other hospitals for other services. These services need to be paid for, i.e. scans, x-rays, CT scans. All of these things need to be paid for, so that there's already an initial cost getting to the main hospital, and then there's a now additional cost getting to wherever else they need to get to, and the cost of the scans. And that's all before actually being prescribed any medication and the cost of that medication. So cost is a huge, huge issue, especially for families coming from villages. And we found that there were a lot of families there that had traveled from their local villages. So that's where we kind of got into some of those conversations about the traditional midwives and the medical staff that we spoke of earlier, for villages with people, with over 400 people in their village. So it's that seems to be a bit lost if families are still having to make this journey into main city. So there's a traveling there, and then we'll come back to the main thing, the cost of medication. So just to kind of give an example, the difficulty in accessing medication, if someone is in crisis for a week or in hospital for a week, the cost of just pain relief could be up to 2,000 dalasi for that week. For some families, that is more than their monthly income. So you can weigh up how difficult it is now for a parent to pay for the medication of their child. And imagine if you've got more than one child with sickle cell, and we did come across several families in that situation. So those are the main things that kind of come up in terms of making comparisons with the struggles of our warriors on the motherland and in the UK. In the UK, we have free prescriptions, we have free screenings, we have free scans, we have a national health service. So we get medical treatment for free. We have an ambulance service that covers travel. We have fundamental equipment. So we're very privileged with all of those resources. But then on the other side, when you're looking at nature, and we are people of nature, and we really need to come back we need to sankofa back to our originality. And when you're looking at the abundance of nature on the motherland, the sun, the vitamin D, the herbs, the merengue, the lemongrass, all the different herbs that they comes in abundance, there's a lack of knowledge of it. The seawater, the oxygen, there's so much that we could be taking advantage of on the motherland to enhance our health and prepare the body for when that crisis comes, that we're actually able to face it head on and challenge it. So yeah, there are contrasting resources available on both sides. So in terms of solutions and where we kind of see ourselves fitting in, several things, main things would be fundraising, awareness, resources, screening, nutrition. So so those are the things that we've come up, we know are needed. So I know you've heard about Curtis Stewart, our late chairperson, and you know, a real supporter of the cause, a real supporter of sickle cell warriors, particularly in the Gambia. And he has so much plans and things that he wanted to put in place through sickle cell cause for the benefit of sicklers in the Gambia. So in his honor, we have created a foundation called the Curtis Stewart Foundation. It's still in its infancy, still a lot of work to kind of put in to cement things, but this is going to be the foundation of support, the foundation of the support that sickle cell cause is going to deliver to our sickle cell warriors in the Gambia will be coming through the Curtis Stewart Foundation. So some of the key things that that foundation will provide will include funds for medication, scans, and transport to hospital. Those are the main funding resources that we want to be able to avail to families in need. And then the second most important, which is actually the most important, is the awareness program. So we want to be able to continue with the work that we're doing, engaging with the hospitals, engaging with families through the hospitals, engaging with families in their homes, through schools and orphanages, to give them that awareness that they need. We do have leaflets available. The contact details will be at the end. And if you want leaflets, we can arrange for leaflets to be delivered to you that you can share with your services, your families, and the local community. So these are the type of leaflets we would have had to hand if we were with you guys on the motherland. But where there's a will, there's a way. So yeah, we have resources that we can post. And the third thing on that list, following awareness, was a health center services. So that is our overall mission. That is our long-term goal, to have an establishment on the motherland, sickle cell cause to be firmly established, where we can actually provide health center services, holistic health center services for our Gambian warriors. Family, so that is kind of it from me for now. I want you to enjoy the rest of the month with the wealth of information that's going to be pouring through. Give your thanks to AGA. You will hear from us again. I think we've got another 2 or 3 slots. So on our next kind of, listen out for us for our next kind of sharing. We'll be talking a bit more about sickle cell cause and the holistic treatments that people can make use of to help prevent serious crisis and just to have a better well-being overall. Please, if I've missed out anything, fill the gaps. But other than that, our contact details, you can get us at sicklecellcause@gmail.com. We're on Facebook and Instagram, Sickle Cell Cause.
Thank you, Leanne.
Welcome.
Thank you. Thank you, family. Thank you for having us. We will be back, as Leanne said, next week with more information about sickle cell anemia and the sickle cell cause. So for now, we thank you for your time and we hope you've learned something. Thank you.